Hello friends, today we are discussing about communication skills. Communication skill is most important part of our lives. Communication required in every field of the lives. Without communication you cannot progress in life. So what is communications? Communication is the exchange and flow of information and ideas from one person to another. It involves a sender transmitting an idea, information or feeling to a receiver. Effective communication occurs only if the receiver understands the exact information or ideas that the sender intended to transmit. So communication process. First is thought. First, information exists in the mind of the sender. This can be concept, ideas, information or feeling. Second thing is encoding. Next, a message is sent to a receiver in words or other symbols. Then decoding. Lastly, the receiver translates the words or symbols into a concept or informations that he or she can understand. Now, barriers of communications. Hindrance in the communications. Anything that prevents understanding of the message is a barrier or communications. Many physical and psychological barriers exist. Culture, background and bias. We allow our past experience to change the meaning of the message. Our culture, background and bias can be good as they allow us to use our past experience to understand something new. It is when they change the meaning of the message that they interfere with the communication process. Next one is noise. Equipment or environmental noise impedes the clear communications. Then ourselves. Focusing on ourselves rather than the other person can lead to confusion and conflicts. Perceptions. Perception, if we feel the person is talking too fast, not fluently, does not articulate clearly, etc., we may dismiss the persons. Environmental factors. Bright lights and attractive persons, unusual sights or any other stimulus provides a potential distractions. Now history of communication revolutions. First communication revolution is the first written communications began with the pictographs. They were made on stones which were too heavy to transfer. During this era, written communication was not mobile but existed. Second communication revolution is writing began on papers, clay, wax, etc. Common alphabets were introduced, allowing the uniformity of language across the large distance. Third, communications of revolutions. In this information can now be transferred via controlled waves and electronic signals. Example, email, WhatsApp, Telegram, etc. Digital form of the communications. Then types of communications. First is forms, types of communication. First is verbal communication. Verbal communication is the most common and most important form of the communications and is associated with an transmittance of language or words between two more parties. This type interaction is primarily comprised of spoken words and written words. However, it also includes any interactions that results in words being communicated. Oral communications. Speaking is considered the best way to coherently and quickly communicate informations. Then written communications. Using written language or words to convey a message is another prevalent type of communications. Sign language. Sign language is another form of verbal communication because of its use of words to convey a message. Advantages of the verbal communication. Uniformity of meaning when utilizing a common language. Fast and typically inexpensive. Specific to speaking, direct and immediate feedback. Then disadvantage of verbal communication. There are sometimes cultural differences in what certain words in a common language mean. Non-verbal behavior communications. Non-verbal communication describes the process of conveying meaning in the form of non-verbal messages. Eye contact. This helps to regulate the flow of communications. Facial expressions. Facial expressions is a most important part in the communications. Then gestures. If you fail to gestures while speaking, you may be perceived as boring and stiff. Posture and body orientations. You communicate numerous messages by the way you talk and move. Proximity. Cultural norms dictate a comfortable distance for interactions with others. You should look for signals of discomfort caused by invading the other person's space. Then vocal factors. Speaking can signal non-verbal communications when you include such vocal elements as tone, pitch, rhythm, timbre, loudness, and inflections. For maximum teaching effectiveness, learn to weigh these 6 elements of your voice. One of the major criticisms of many speakers is that they speak in a monotonous voice. Listeners perceive this type of speakers as a boring and dull communications. Advantage of the non-verbal communication. A large proportions of non-verbal communication is universal across different cultures. For example, facial gestures expressing feel of anger, fear, and happiness are almost universal throughout the world. Develop intimacy with other parties beyond the standard message being conveyed. Demonstrate interest in the interactions. Then disadvantage of nonverbal communication. Nonverbal cues can sometimes contradict the intended meaning of the verbal communication. It is difficult to conceal at times when the individual would like to disguise it. In most of its form, it can only be used if those individuals you are communicating with can see you. Difficult, if not impossible, to convey complex ideas. Way to improve communication skills. How to improve communication skills? We all have people with whom we have to work to get things done. Our ability to communicate with clients, customers, subordinates, peers, and superiors can enhance our effectiveness or sabotage us. Many times, our verbal skills make the difference. Here are ways to increase verbal efficacy at work. Develop your voice. A high whiny voice is not perceived to be one of the authority. In fact, a high soft voice can make you sound like prey to an aggressive coworker who is out to make her correct at the expense of anyone else. Slow down. Slow down. People will perceive you as nervous and unsure of yourself if you talk fast. However, be careful not to slow down to the point where people begins to finish your sentences just to help you finish. Animate your voice. Avoid a monotonous. Use dynamics. Your pitch should raise and lower. Your volume should be soft and loud. Listen to your vocal TV news anchor. Take notes. Enunciate your words. Speak clearly, don't mumble. If people are always saying who to you, you are mumbling. Use appropriate volume. Use a volume that is appropriate for the setting. Speak more softly when you are alone and close. Speak louder when you are speaking to longer groups or across larger spaces. Pronounce your words correctly. People will judge your competency through your vocabulary. Use the right words. If you are not sure of the meaning of the word, don't use it. Make eye contact. I know a person who is very competent in her job. However, when she speaks to individuals or groups, she does so with her eyes shut. When she opens them periodically, she stares off in a directions away from the listeners. She is perceived as incompetent by those with whom she consults. Use gestures. Make your whole body talk. Use smaller gestures for individuals and small groups. The gestures should get larger as the group that one is addressing increases in size. Don't send mixed messages. Make your words, gestures, facial expressions, tone, and messages match. Disciplining an employee while smiling sends a mixed message and therefore ineffective. If you have to deliver a negative message, make your words, facial expressions, and tone match the messages. Match the messages. Improve your communication skill will improve your productivity. Improve your communication skill will improve your productivity. So in medical field, it is most important part in communication skills. If doctor have no communication skill, then there may be conflicts between patients, relatives, and sometimes court matters occur. So when interact with the patients and relatives, be smoothly interact with the and communicate smoothly with the patients and relatives. Thank you very much.